Good morning, everyone. So today I'm performing a tummy tuck with a pubic lift, and my patient today is in fantastic shape, but post-pregnancy she has loosening of her abdominal wall with muscle separation. She also has an umbilical hernia and excess skin of her abdomen and her pubic area. So the surgery today is going to repair her abdominal wall muscles and tighten her abdominal wall, repair her hernia. That's going to be done by one of my general surgery colleagues. And then I'm going to remove and tighten excess skin of her abdomen and the mons area. So I filled all the tissues with the numbing solution, and I've delineated a low curved tummy tuck incision that'll be easily hidden under any underwear bikini bottom. And I've placed numbing medicine under the incision, so when I make the incision, there's little to no bleeding, and also the patient has no pain even though she's under general anesthesia. I very carefully deepen this incision down to her abdominal fascia. See, this is the covering over her ab muscles. And I'm just very carefully and meticulously lifting the tissues off the abdominal wall. And if I see any vessels, just carefully cauterizing them before they bleed. So there's little to no bleeding in this surgery. And because I'm not burning her tissues, there's little to no pain. So I've carefully lifted the tissues around her belly button, and you can see she has a really large hernia in this area. This was all intra-abdominal coming out, and look, it's really stretched out her belly button, so I'm gonna have to reshape that when I make the new belly button. So I've elevated all the tissues off the abdominal wall from the pubic bone all the way to the top of the ribs. And it's important to do the tightening the full length so it feels nice and even and tight everywhere. And I'm going to measure how much abdominal wall tightening and muscle repair I can perform. So I've measured the amount of muscle separation and tightening I can perform. And at the widest point, it measures about 4.5 centimeters. And you can see when I bring the edges together, how nice and flat and tight that makes her abdomen. So I've completed the first layer muscle repair. Look how perfect and even and straight the muscle has come together. And it's really important to do this meticulously and precisely so her muscles are perfectly aligned. Now I'm going to do the second layer to reinforce it. And now I'm placing the second layer to reinforce the first. You can see just how perfectly this brings it together. And that way, if she sneezes or coughs or laughs after surgery, she'll have 2 layers to make sure that nothing falls apart, and it's very secure. So beautiful and tight 2-layer muscle repair. Look how perfectly straight and even that is. And now I'm placing long-acting numbing medicine underneath the muscle repair for long-term pain relief, and so my patient will have little to no pain after surgery. And with my gentle technique, patients don't need any prescription pain medication, and they have a quick and easy recovery. And next I'm performing the pubic lift in order to elevate and tighten the mons. See how that's going to make it nice and flat. Okay, so now I'm going to measure and weigh the flap. So the flap measures about 9.5 inches, which is equivalent to 24 centimeters. And I use a string to make a line from her pubic area all the way to her xiphoid, a perfect midline, and that's where I've marked her belly button, and that's where the final one's going to be. Okay, now I'm getting hemostasis, just checking for any bleeding. And you can see how clean this field is. She's had little to no bleeding in the entire case. So I've delineated the lateral border of the ab muscle, and now I'm placing 2 rows of tacking sutures to secure the flap and create the appearance of abs. You can come off now, thank you. And now I'm just very carefully closing in layers. You can see this is my fascia on the abdomen flap. I'm connecting it with the fascia here on the lower incision, And this is the deep strength layer. And it's really important to close in layers from deep to superficial, so that way this is lined up completely even. If you don't close in layers, what happens is, see this fat thickness on both sides? It spreads apart, the incision sinks down, and then you get a shelf, a wide scar, and another shelf. And that is something I see all the time for patients who come to me for tummy tuck revisions. Okay, so the flap measures 1 pound and 14 ounces, so almost 2 pounds. And that is equivalent to 853 grams, so almost 1 kilogram. I'm just closing the deep dermal layer, which is the layer just underneath the skin. And you can see how beautifully the incision is coming together. See how this is perfectly lined up? I've closed it in layers from deep to superficial. And you can see how with each layer, the incision gets thinner and thinner. And by the time the skin suture is placed, it's a very thin line. And when it heals, it'll be a barely visible scar. So I just wanted to demonstrate the subcuticular suture. So this is the skin layer. You can see it's already super thin before putting this in. And I think that it's really important to line this up perfectly. You can see how there's no bunching or pleating, there's no twisting in or anything like that of the flap. And that bunching never goes away. So it's really important to tailor the flap and put it together so it's perfectly smooth and even. And I'm just putting the finishing touches on the belly button. You can see how I've created a little dimple in the middle. The belly button is dented in like a little innie, and all of my sutures are in the inside. They're not floating on the surface. So when it heals, it'll look like a natural looking innie belly button. So I just wanted to show her final result. Beautiful flat abdomen, nice low and thin incision. Okay, and to compare with the before, you can see what a huge difference this has made. In 3/4 view, you can see beautiful abdominal contouring. Looks amazing. Finally, a close-up of the belly button. You can see natural innie belly button.